Hello, everyone. Firstly, I would like to thank the organisers of the conference for inviting us or for giving us the opportunity to share this research about cancer awareness and attitudes among the traveller community in Ireland. These are the co-authors of the study. They're also the members of the steering group, the project steering group I'll be referring to later. So thank you to the NCCP for funding the study and the RCPI for ethics approval. So the aim of this presentation is to present our co-designed research process to date and to discuss the important insights gained. Just in the interest of time, I'm going to go very briefly through the background and the aims and objectives so that I can concentrate a little bit more on the slides towards the end. So I hope that's okay. And of course, I'll be happy to take any questions later. I want to identify our the broad research team, so the UCD research team, Pavy Point, Traveller and Roma Centre, colleagues, and the NCCP. So as I mentioned, this is the project steering group. I'm sure most of you are familiar with the key national policies and reports that inform this study. So all of these documents and national policies that are focused on cancer prevention and early detection, particularly among deprived populations, but also very importantly, the social determinants of health, as well as was very evident in the All Ireland Traveller Health Study, which was published in 2010. So the study aim is to gain an understanding of cancer awareness and attitudes among the traveller community and to identify any barriers and enablers to cancer risk reduction behaviours and early diagnosis of cancer, with the overall aim of reducing morbidity and mortality due to cancer among travellers. I'm not going to go through the objectives in detail, but as you will see, they're focused on us gaining or identifying knowledge and or awareness of risk factors for cancer, also early and late signs and symptoms of cancer, cancer screening, and also determining participation in the cancer screening programmes. We also wanted to look at the health information sources used by travellers, and also to identify health-seeking behaviour and factors that impact on this, particularly the barriers and enablers to accessing health services. And very importantly, we wanted to assess the impact of the social determinants of health on health-seeking information and behaviour. The last objective there is to explore perceptions of healthcare professionals, that's GPs, public health nurses, and general practice nurses and screening professionals regarding the barriers and enablers for travellers when engaging in the health system. The last three objectives there, we are aiming to achieve those through interviews, and the earlier objectives through a peer-administered survey. So for the purpose of this presentation, I'm just going to focus on phase 1 and phase 2, mainly on phase 1, the development. But I just want to note here also that the UCD research team, when we were initially looking at our study proposal, we undertook some pre-study scoping work and held key stakeholder meetings with HSE, Inclusion Health and Pavy Point to identify the most appropriate methods for the study. So the co-designed multi-method study, as I mentioned, with survey, a peer-administered survey and interviews with travellers and healthcare professionals. So the survey is going to be administered by that was our initial plan, that we would ask the primary healthcare traveller projects, the primary healthcare workers working within those projects, to administer this cross-sectional survey to 380 travellers. That was our target. I've put there over 18 is actually aged 18 and over. And so this would be using a modified, culturally appropriate version of the National Survey on Cancer Awareness 2022 survey, which the NCCP had used in the general population. We included additional questions to address the impact of the social determinants of health on cancer awareness and health-seeking behaviour. And as part of that, we were asking every third participant to participate in a follow-up interview. So these interviews, the plan is to have them semi-structured, one-to-one, face-to-face, or we also put into that we could have them via phone or online, and our target sample there is 20 travellers. We've actually interviewed 5 so far, but I'll come back to that later. The topic guide for both the interviews with the travellers and the healthcare professionals is based on the survey and also informed by the literature and specialist knowledge of the project steering group. And it was designed to explore in greater detail the barriers and enablers to cancer risk reduction and early diagnosis of cancer, with a particular focus on the impact of the social determinants of health. And similar then with the interviews with the healthcare professionals, we wanted to identify their perspectives, explore their perspectives and experience related to cancer screening participation, healthy lifestyle behaviours, and timely reporting of red flag symptoms, potential cancer symptoms where relevant. So co-designed research, I'm not going to go into it in detail other than to say that we're all aware that it's about meaningful engagement of public and patient involvement. I'll talk a little bit about that a little later in relation to our own study. We know that there are several benefits and some challenges as well, both to public patients and also to researchers. So in terms of our study for phase 1 development, what did we do? Well, there were a lot of meetings for this co-designed process. We initially met with Pavy Point and completed anti-racism training. I mentioned about the discrimination earlier. Obviously, this was a very important starting point to build trust with the community. We gave presentations to the HSE Traveller Health Advisory Forum and the National Traveller Health Network. And this is a forum that is the forum that is important in relation to the primary healthcare traveller projects, who are the interface between the HSE and the community around the country. And we knew that this would be important in relation to getting buy-in for the actual research. Subsequent planning meetings were held with our colleagues in Pavy Point and the entire project steering group to co-develop and refine the proposed research methods, including reviewing and revising the proposed questionnaire and including the additional questions on the social determinants of health. Subsequently, of course, in relation to the ethics application, we met and had many meetings outside of meetings, face-to-face meetings through email in relation to thinking through the logistics, such as storage of the surveys after data collection. We subsequently had meetings in Pavy Point around cultural proofing of the survey questionnaire, and this was very important in making the questionnaire more clear and understandable, and we felt that this was very important ultimately for data collection. And we also undertook 9 pilot surveys, and the feedback from some of those further informed our training plans, which we held with the primary healthcare for traveller projects. So for better research, this is from Slattery and colleagues. They talk about their INVOLVE acronym, and so very importantly, as we all know, investing in co-design, paying and rewarding public and patients is key. And the training I'll come back to later. The very important at the outset, of course, is talking about the why and the how and the vision for the research. We made it very clear at the outset that it was about improving cancer-related outcomes for travellers, and we communicated that every time we had the training sessions around the country. We ensured validation of the participants, and the expertise of the peer researchers, the primary health workers, was acknowledged throughout. And all of the meetings were held in Pavy Point and at the primary research projects around the country. We led the engagement. We also listened carefully and addressed the concerns that came up, such as around signing consent forms. There were a number of discussions in relation to that. And very importantly, of course, is trust building and rapport building throughout the process. So it was a very busy time going around the country, and we had our meetings in the East. First of all, these were all the primary healthcare travel projects that were involved, and our logos at the bottom. I don't have quite all of them in there yet, but there will be some coming.
2 minutes left, Trish. Thanks.
Thank you. So we had some very nice welcomes around the country. The tea and the scones was put out first, so that was very heartening to begin with. And it won't come as any surprise, the key elements to this process for all of the listeners. It's all about relationship and rapport building, trust, respect, and flexibility, such as acknowledging that during the month of August, travellers would generally be on annual leave, so we wouldn't be doing any data collection during that time. We took on board, we weren't able to, at that point of the training sessions, change the survey because that had been obviously piloted and agreed upon, but we did take on board some suggestions, and we had some very interesting discussions throughout that we know is going to come out through the findings, such as fear of cancer among travellers and the impacts of the social determinants of health. What was a nice little side effect was that we were able to disseminate this little green book, as it was referred to, from the NCCP around reducing the risk of cancer. They really liked that in terms of, the images and the very clear communication. So to date, we have completed, we've had 435 completed surveys returned. So we're above our target sample size, which will be, I'm sure, the first and the last time ever for research that many of us will be involved in. Very few have declined. We have one more of the projects to return completed surveys. There have been some challenges along the way. I just won't get into those now in the interest of time. But the interviews with travellers, as I mentioned, we have 5 completed, and we have more planned. We also have completed 15 semi-structured interviews with healthcare professionals. We'd still like to interview about 3 GPs. If anybody knows of any GPs in the West or Northwest that would like to participate, that would be great. And so in conclusion, then, our take-home messages are that the data collection to date, we're very pleased with that, and we're very grateful to the leadership from Paddy Point, the primary healthcare traveller projects, and the primary healthcare workers. It's all about building and maintaining good relationships between the researchers and the study partners, and in this case, primary healthcare traveller projects and primary healthcare workers, but also for the primary healthcare workers and the traveller families within their communities. This has been fed back to us, that's very important. So we're looking forward to analysing the data and working with our colleagues in Paddy Point and the NCCP to ensure the study findings are shared with the primary healthcare travel projects and the primary healthcare workers, and ultimately all the traveller families across the country. And we wish to acknowledge and sincerely thank all of those involved.